First of all, I've been doing this. I've been working with kids with CP as an attending surgeon at Columbia since 1980. So it's not hard to imagine that in that many years, if I was treating kids who were 9 or 10 in the 80s, they're really long adults at this point. And I'm lucky enough to be in a situation where I don't have to give them up. In many children's hospitals, providers are not allowed to see kids past age 19 or 20, that's it. So in our situation, we have a children's hospital, but it's side by side with an adult hospital, so I'm able to continue seeing those patients, and I choose to. One of the things that, as you evolve, as you get the process going with this product, if you will, also people like me who are reaching out with public education on our our CP Center website or that sort of thing, but also this kind of documentary would be very powerful, would be very useful for that. But the biggest thing I can do for this in terms of advocacy, quite frankly, is to get the clinical research done. So, because you need something out there that people can hang their hat on, that you need an evidence base, to say this is really what we're doing. In a sense, I'm not as embarrassed as I should be about being an advocate for a procedure without the peer-reviewed literature yet being available to support it, because I don't do the procedure. It's not like so I don't own it. I'm just working as an advocate for my patients for whom I have very little else to offer. It's not serious surgery in the sense of life-threatening, limb-threatening. It's really just, I'm speaking to you about this. You went through it. I didn't go through it. But
but still.
It's probably, I think that it's simpler in many ways than the orthopedic surgery that we do. I have to say that most patients we've recommended for this procedure have been cognitively high functioning. But that's just because that's where we are right now. There are really profound clinical effects of rhizotomy on patients, and of course the primary reason for doing the rhizotomy is to reduce global tone. And it's going to have a little different effect depending on the type of CP that the patient has. So clearly the most beneficial effects are on the kind of, if you will, classic spastic cerebral palsy patient. But it's real. Tone is definitely reduced. It makes management easier. Your physical therapy works better. And even if you then go ahead, as we often do, to perform an orthopedic procedure to correct fixed deformity that has occurred, it's much more effective.